Diabetes is a lifelong disease marked by high blood sugar in the blood. With this disease, three things can happen. The pancreas stops making insulin, your pancreas doesn't make enough insulin, or the pancreas makes insulin but your body doesn't use it effectively. Diabetes is a serious medical condition that can be treated. According to the Center for Disease Control and Prevention, people can delay and possibly prevent the disease by losing 5 to 7% of their total body weight. By adopting some healthy lifestyle habits and paying attention to specific preventable diabetes complications can help you live a longer, healthier life. Some lifestyle changes can be as simple as eating healthy snacks and meals, exercising regularly, and taking medication if needed. Taking the stairs instead of the elevator or packing a healthy lunch instead of getting fast food or going to a restaurant can be a few things you can do. Since type 2 diabetes is rising dramatically in children, teaching them how to be healthy at a young age is very important. There's also information that you can get at your local Walgreens if you have any questions. Now to Grace for information on prediabetes.
Did you know that at least 54 million Americans over the age of 20 have prediabetes? Prediabetes is a condition in which individuals have blood glucose levels higher than normal, but not high enough to be classified as diabetes. People with prediabetes have an increased risk of developing type 2 diabetes, heart disease, and stroke. Studies have shown that people with prediabetes who lose weight and increase their physical activity can prevent or delay type 2 diabetes and in some cases return their blood glucose levels to normal. There are a few different ways to test individuals to see if they have or are at risk for prediabetes, which usually leads to diabetes. Doctors can use either the fasting plasma glucose test, also known as FPG, or the oral glucose tolerance test, also known as OGTT, to detect prediabetes. Both require a person to fast overnight. In the FPG test, a person's blood glucose is measured first thing in the morning before eating. Normal fasting blood glucose is below 100 milligrams per deciliter. A person with prediabetes has a fasting blood glucose level between 100 and 125 milligrams per deciliter. If the blood glucose level rises to 126 milligrams per deciliter or above, a person has diabetes. In the OGTT test, a person's blood glucose is checked after fasting and again 2 hours after drinking a glucose-rich drink. In the OGT test, a person's blood glucose is measured after a fast and 2 hours after drinking a glucose-rich beverage. Normal blood glucose is between 140 milligrams per deciliter 2 hours after the drink. In prediabetes, the 2-hour blood glucose is 140 to 199 milligrams per deciliter. If the 2-hour blood glucose rises to 200 milligrams per deciliter or above, a person has diabetes. If you have prediabetes, you can and should do something about it. Studies have shown that people with prediabetes can prevent or delay the development of type 2 diabetes by up to 58% through changes to their lifestyle that include modest weight loss and regular exercise.
Gaining weight was easy. All I had to do was sit down and eat. Losing weight's a lot harder. I have to work at it every day. But with every step, I lower my risk for type 2 diabetes and heart disease. And that makes every step, every choice, every day very much worth the effort.
Learn how you can help stop diabetes by losing weight, eating healthy, and staying active. Visit checkupamerica.org or call 1-800-DIABETES.
Checkup America is an American Diabetes Association program working to help people lower their risk for type 2 diabetes. This program focuses on multiple factors that contribute to type 2 diabetes. Some of these factors include your cholesterol. Your cholesterol is a form of fat that is carried in the blood. Unhealthy levels can raise your risk for type 2 diabetes. Gestational diabetes is a form of diabetes that occurs during pregnancy and can put you at a higher risk of developing type 2 diabetes later in life. Managing your blood glucose levels and your weight are also two different ways to help prevent type 2 diabetes. Being aware of the factors that you cannot change, like your age, race, gender, and family history, can help you take smarter steps to lowering your risk. Eating healthy, managing your blood pressure, staying active, and not smoking are also factors that help you decrease your risk of type 2 diabetes.
Before the break, we told you 57 million Americans are at risk for developing something. We're talking about prediabetes. If left undiagnosed, it can lead to full-blown diabetes and major complications. And joining us in our studio audience today to talk about this is Minute Clinic nurse practitioner Kelly Kell. Welcome, Kelly.
Thank you.
Good to have you back on. And what I want to emphasize to everyone is that prediabetes is where your blood sugar levels are high, but not high enough to be diagnosed with actual diabetes. Why is that important? Because diabetes can either be avoided or delayed, and the complications in many cases can be avoided, but you got to have early diagnosis. Of course, it's difficult because the symptoms sometimes are so subtle, Jim.
Mm-hmm. And then, that brings up the different types of diabetes. First off, there's type 1 diabetes, and that's also called childhood diabetes because it usually starts in childhood. And basically, the pancreas gets damaged by illness or a virus or something and stops making insulin, so the body can't process sugar. The symptoms, which is most important, frequent urination or excessive thirst or unexpected weight loss.
And in type 2 diabetes, typically that develops over time, happening more and more in our younger folks. But your body does produce insulin. Your body, though, doesn't respond to it the way it did before, so your blood glucose levels still get too high. And the thing is, you put yourself at risk for infections. You can have numbness and tingling in your hands and feet, and a lot of other very subtle symptoms that can lead to heart disease, kidney problems. So early detection is key. And Kelly, talk to us about detection, which does lead to prevention.
Sure, absolutely. So Minute Clinic offers screenings. Our patients are 18 years of age and older, and we just take a little bit of blood from the finger, and the results are usually ready in about a couple minutes, and we'll review those numbers with the patient and kind of talk about what those numbers mean.
And who should get tested?
So generally, we say adults 45 years and older should get screened every 3 years, unless you have some increased risk for diabetes. So if you have obesity or if you have someone in your family that's diabetic, then we recommend more frequent screenings.
So screening is so very important, and if you think you may be at risk, you've got to consult your primary care doctor. Kelly, thanks for being with us today. We appreciate it. Now, more tips to keep you and your family healthy are coming up after the break.
Knowing if you are at risk for diabetes is key to determining what measures should be taken in your prevention plan. By taking a risk test, you focus on what issues should be dealt with first. Before we take our risk test, we're going to look at some of the types of risk that you could see in prediabetes. If you are at low risk, right now, your risk for having prediabetes or diabetes is low, but your risk goes up as you get older. Talk to your doctor about how to keep your risk low. If you are at risk for prediabetes, you are at higher risk for prediabetes, which means your blood glucose is higher than normal, but not high enough to be diagnosed as diabetes. Talk to your doctor about ways to reduce your risk for diabetes. If you are at high risk, you are at higher risk for having type 2 diabetes. However, only your doctor can tell you for sure if you do have type 2 diabetes. Talk to your doctor to see if additional testing is needed. Now let's take our risk test. Okay, we're going to start at the top with a question. Are you under the age of 45 years old? If you answered no, at your height, is your weight equal to or more than at-risk weight? If you answered yes, you are at high risk for diabetes. If you answered no, are you under the age of 57 years old? If you answered no, you are in between at-risk and high risk for prediabetes. If you answered yes, does your mother, father, sister, or brother have diabetes? If you answered no, you're at low risk, but if you answered yes, are you white, Caucasian? If you answered no, you're at high risk, and if you answered yes, have you ever been told by a doctor or other health professional that you had hypertension or high blood pressure? If you answered no, you are at risk for prediabetes, and if you answered yes, you are at high risk. Now if we go back up to the top, are you under the age of 45 years of age and you answered yes? At your height, is your weight equal to or more than at-risk weight? If you answered no, you are at low risk, but if you answered yes, you go to the next question. Have you ever developed diabetes during pregnancy? If you answered no, you are at risk for prediabetes, and if you answered yes, you are at high risk for diabetes.
Have you noticed a recurring theme throughout these clips? That's because preventing diabetes is a relatively simple concept. In both the videos by the doctors and Checkup America, there were 3 simple rules that were repeated. These were losing weight, staying active, and eating healthy. Following these 3 steps are at the forefront of preventing diabetes. In recent years, there has been a change in who needs to focus on these preventions. Originally, everyone thought type 2 diabetes only affected people above 45 years, meaning that if you were under the standard, you had nothing to worry about. Currently, there is a shift in adolescents developing type 2 diabetes. This solidifies the fact that not just because you are a younger person, you are not exempt from developing this disease. That type 1 diabetes is still the most prevalent in children. Steps in prevention of diabetes are not taken early in childhood, then type 2 could start to reach higher and higher levels. It is the duty of the parents to take this responsibility and make sure that the child has the tools for fighting off diabetes. Finally, many people do not think about one of the most important aspects of prevention, which is getting tested. By getting tested, as shown in the doctor's video, you will be given and explained a number. This number, which was determined relatively simply, shows how close or how far you are from developing diabetes. If you are well overweight or have a family history of diabetes, you may want to get tested because you have a higher risk of developing diabetes. With this testing comes knowledge. Once you find what your number is, you may realize it is time for a change, where the doctor will recommend a healthier diet and maybe even an exercise regimen. The doctor will also be able to give you information that you can hold on to, which will help you remember why you need to follow these 3 simple steps in the first place. Now, enjoy the musical stylings of Dr. John D. Clark, who is here to once again explain these steps of diabetes prevention. However, instead of the 3-step model that has been recurring throughout this session, he will be actually presenting a 4-step model.
It's about diabetes and diabetes prevention. So,
excellent.
Yes.
Dr. Clark, good to have you here this morning.
You.
Take it away. Thank you.
Yeah, the rules, diabetes prevention. Here we go like this. Yo, sitting in the waiting room spot, watching the clock, thinking, do I need to bounce or get results from the doc? Took out my Walkman when this old man came walking in. He looked kind of cool, so I figured I would talk with him. Anticipating some sort of complication. Said his leg was feeling numb, he might need an amputation. Fair the situation, but he shouldn't be complaining. Many years he didn't exercise or take his medication. A diabetic that regretted the truth, that he really wasn't careful in the days of his youth. Diagnosed at 18, he thought he was straight, didn't care about his weight and all the junk that he ate. Was in denial for a while, thought he felt great, but at night, like 5-6 times he urinate, kept him awake, vision blurry and his head it would ache. Faced with the fate of a careless diabetic's mistake, cause he took it lightly, was likely that he might be getting kidney failure and becoming slightly blind with his leg cut off above his right knee and his wife injecting insulin into him nightly. He had to share his story cause he'd been blessed. He was supposed to die a year ago from all this mess, but he was glad that I heard what he got off his chest. And he had 4 rules that he had to stress. Rule 1, always maintain your weight. Rule 2, never try to pile your plate. Rule 3, avoid sweet carbs and cake. And rule 4, exercise to keep in shape. Rule 1, always maintain your weight. Rule 2, never try to pile your plate. Rule 3, avoid sweet carbs and cake. And rule 4, exercise